My wife and I were traveling to Turkey, so we're on overseas flight. And we always have a quick joke with my wife about what if I would be called in to perform an emergency in mid-air. My wife knocks on, gives me one of those quick jabs in the side and says, "Boris, I think they just called for a doctor." I said, "No, please, enough with the jokes. Let me just finish watching the movie." And she's like, "No, I'm quite serious. They just asked for a doctor." So I get up, go to the front of the plane, and my heart is pounding. And clearly, all I'm trying to do is stay calm, cool, and collected, the 3 C's of emergency medicine. I go to the front, and there is a flight attendant who meets me and says, "Are you the doctor?" He's like, "Yes, how can I help you?" He's like, "Yeah, there's a newborn up front who needs your attention." I see a mother holding about a 4 to 5 week old child, and clearly, right away, you can see and feel and smell there's nothing wrong going on. It's just, kid looks comfortable, nice color. I said, "What's going on, Mom?" And she says, "Well, my child is constipated for about a week." So at this time, I say, okay, let me take a look. I already knew that the kid is not sick, at least from the appearance and from the look. And I quickly got a history. It looks like it was no normal delivery kid, no fevers, no vomiting, breastfed. So afterwards, about 5 minutes of conversation, we sort of established that I established that the kid basically has a normal constipation for a breastfed baby. And I was reassured to Mom, and Mom felt very comfortable. She felt at ease. And at that time, she said, "Thank you. I really appreciate you being, this your pediatrician, correct?" At which I said, "No, I'm not a pediatrician. I'm actually an emergency room physician." I said, "You know what? Listen, this is exactly what we do with the emergency room physicians. True, I didn't save anybody's lives. I didn't perform any cardiac massages. I didn't give any epinephrine for anaphylactic shock in the mid-air or deliver any babies. But what I did provide is a sense of comfort, a sense of calmness to the family. And this is exactly what we do in emergency medicine physicians day in, day out. Not every patient is sick, but at the same time, it's our job and our responsibility in the emergency department to provide that sense of security for patients and to make sure that they understand that for them it's emergency. And that's the reason why we're the emergency room physicians who actually provide that sense of calmness."